Hello, I'm Dr. Rajat Gupta. I'm board certified plastic surgeon working in Delhi. And what we'll be talking to you about is what to expect when you are contemplating facelift surgery. I get a lot of patients asking about different options for facelift surgery, a mini facelift, a full facelift, a neck lift, a smash plication, and they don't know what these terms means. And I've already made a video explaining what these terms mean. Now, depending upon a patient's examination findings, what they exactly need and require, we decide about a treatment plan, and we discuss with patient about what technique and what type of facelift procedure will suit on you. Now, once you have decided for facelift surgery, there are certain do's and don'ts. First, if you are smoking, quit smoking for at least 1 week before surgery. Now, there are a lot of textbooks which say you should quit smoking for at least 8 weeks before surgery, but at least quit for 1 week. You should avoid having any herbal or green tea. So, now once you have had facelift surgery, after the surgery, most of my patients go back home the same day evening. The way we do the surgery is mostly daycare surgery. However, if a patient wants to stay in the hospital overnight, or is not feeling well, or is traveling from abroad or out of city alone, we keep them in the hospital overnight. And then they go back home the next day. There's bound to be some swelling and bruising around the face, which is much more pronounced for 1 week to 10 days, and then decrease by 2 weeks' time. The stitches which are used are removed after 7 days. After 7 days, most of the patients are really fine and can apply some concealers or some makeup and be back to normal routine. Now, when they go home the next day after surgery or same day after surgery, from next day they can resume all their daily activities. There is no physical restrictions or physical rest required. They are socially restricted although because of the bruising and swelling. And as the bruising and swelling goes down, they can be back to society depending upon their recovery. Most of our patients don't complain of any pain, they just complain of a tightness or a stretch kind of a discomfort, which is expected because you tighten your underlying muscle in the skin along with. So there's not much pain, but a kind of a tightness feeling which is there, and that feeling also settles down by 7 to 10 days as you get accustomed to your new face and that tightness. Apart from this, it's a very comfortable surgery. Patients have a very gratifying results because they can see the result on the same day. A nice jawline, a nice facial contour is actually visible on the same day, and as the swelling will go down in the next couple of weeks, a patient assumes a much more natural looking face and a very gratifying result. I've tried to answer some of the post-op concerns which patients have. Now, for first 5 days after the surgery, we prescribe them basic antibiotics and analgesics as prophylaxis so that the patient remains comfortable. I also ask patients to apply something called as arnica gel, which helps reduce the bruising and swelling. Cold fomentation or ice application is also advisable so that the bruising and swelling settles down quickly. I've tried to answer most of the questions people ask after regarding post-op recovery or facelift surgery. It's very comfortable surgery to begin with, and not too much post-op precautions are actually required. Having said that, if you have more questions regarding the surgery, please write into us and we will be there to help you. Thank you.